So the violent incidents, let's not call them protests, the incidents that happened, looting and violence, impacted the health industry and interrupted vaccinations in Kwa-Zulu Natal and in Gauteng. Wits Professor of Medicine, Francois Venter, joins me now to discuss the implications of this. Let's start with the good news, Prof, because, you know, there's not enough of that doing the rounds. What seemed to be good news was that actually you were saying, you were reporting, and government was reporting as well, that Gauteng, which has been the epicenter of the third wave of COVID-19, had reached its peak and the numbers were starting to descend. Before we talk about the impact of the past week, let's talk about that first. There was an observable trend, was it not?
That's right. Our numbers are a little bit rattled thanks to the last week's protests, but there does seem to have been, we seem to have hit our peak, sadly at a very, very high level. We will see still for the next week or two the hospitalizations and the deaths associated with that peak. But the good news is that we passed the worst of the third wave in Gauteng. Unfortunately, many of the other provinces, it's still going upwards, not quite at the rapid rate that we saw in Gauteng, but you know, they will all hit their own peaks in the next week or two, I suspect.
And you do say that, and the observation is that even though the province of Gauteng seems to have peaked, but it's still peaking at a really high level. So now would not really be the time to drop our guard, with the result that the strain continues on the health system, including the numbers of hospitalizations, right?
No, absolutely. The numbers are much higher than any of the other provinces, even though we've come down from our peak. So people still need to be vigilant. It's the usual advice, which is, avoid indoor gatherings, and if you can't, wear your mask. Open windows, keep the doors open, even though it's very cold at the moment. Just try and protect yourself as much as you can. We will have a fourth wave in the future. You just need to survive the third wave.
So let's come to the bad news then. While we were starting to see the graph starting to come down, it's quite likely, you say, that the graph may actually fluctuate again and we might face a spike, given the fact that, we saw what we saw in the last few days, in that there's no thinking about wearing a mask or social distancing when people are rushing to loot a store at Jabulani Mall, for example.
I'm sure we're going to see lots of infections due to the protests, and I think with those pieces we're going to be picking up for the next couple of weeks, we'll see those new infections at the moment. People will start presenting sick, and then next week, we'll see the hospitalizations. Any form of congregation, as you say, particularly indoor congregation, is going to facilitate spread of this virus. This Delta variant is so much more transmissible than what we had in the second wave over December and January, that you probably you're putting yourself in a great deal of danger when you go indoors with other people who might have COVID.
I can only imagine, as a medical professional, what must have been going through your mind when you were seeing some of these crowds, right? We've lived with this virus for a year and a half now, and seeing people congregating in one place has become so abnormal. Just share with me what was going through your mind as you were seeing people shouting at the top of their voices, not masked, and emotions boiling over, packed like sardines in some instances.
I think there's a certain level of despair. We've got a healthcare system that's completely overwhelmed in Gauteng, that's under stress in the rest of the country. And seeing people doing this, our politicians as well, it's not just the people involved in the protests. Seeing people congregating without you feel like you've spent a year and a half preparing the healthcare system, but people are not taking it as seriously as they should. I think we all get the despair and the fatigue we all have around the COVID prevention interventions, but people just need to understand that until they're vaccinated, they just need to try and prevent getting this virus. It is not a minor virus. It is, even if you survive it, the consequences in particularly older people are severe. So my message to my friends, my family, my patients, to everyone is just get through the third wave, get your vaccination as quickly as you can, because that's the ticket out of this mess as quickly as we can.
And as you talk about vaccines, one of the other impacts that I think you will have observed is the disruption of the vaccine program, particularly in the areas that were affected by the looting and destruction of malls and shopping centers, which at times house facilities that actually carry out vaccinations. I'll give you an example, Prof, and I think you'll be familiar with this more than I am. Just checking where I can get vaccinated because, you know, my turn has come, being a 1980 child. I noticed that Discam, for example, which is usually conveniently located, had to issue out a notice about the impact on their vaccination sites over the last week or so. That sets us back, doesn't it?
No, it really does. We need to be vaccinating between 200 and 300,000 people a day. And to their credit, I think government has managed to start nudging those numbers. In Gauteng, the protests certainly disrupted things, but people have managed to very quickly get back on their feet again. And I think the numbers have shot up. There are supply line issues the protests have created. Kwa-Zulu Natal is still a disaster and is going to need a lot of attention in terms of making sure there are alternatives. A large number of pharmacies were looted or even burnt down. And those sites were very convenient, as you say. The private pharmacy networks have been amazing in terms of providing vaccinations. Yes, I think KwaZulu Natal is going to need special support to try and expand numbers. I see government has announced, the rise of pop-up sites for vaccines and things, and I think we need to be encouraging that as much as possible. I think what I've also seen that's encouraging, and you probably have as well, is that people are sharing very quickly on social media, go to this site, it's open, it's not that busy, go and get your vaccine as quickly as you can. And I think for all of us, just to try and herd as many, particularly older people and people with comorbidities towards the sites, we've only vaccinated a tiny percentage of people fully in the over 60 age group. So anything you guys can do out there to try and help people into the system, please do so.
Yeah, absolutely. Thank you for your insights there. That's Professor of Medicine at the Wits University, Professor Francois Venter, joining us here on Upfront on eNCA.